For women, there may be some deformation in the vagina due to reasons such as pregnancy, vaginal birth, and aging. One of them is vaginal enlargement. Vaginal enlargement can be corrected with vaginal tightening operations. Vaginal enlargement can negatively affect women's sexual lives. Vaginal infections can also be seen more frequently in case of vaginal width. To prevent these, to correct deformation and to restore the anatomy of the vagina, vaginal tightening surgery, namely vaginoplasty, is performed. The vagina is a structure made up of muscle and connective tissue. One of the components of connective tissue is collagen. Due to aging, vaginal birth, genetic structure, pregnancy, these tissues are affected and the vagina expands. The most common cause of vaginal enlargement is vaginal deliveries. In difficult births, tears may occur in the muscle and connective tissue. Situations such as prolonged delivery and the inability of the baby to descend to the roof increase the risk of vaginal enlargement. People with genetically weak ligaments and muscle structures can have a vaginal enlargement even if they do not give birth. In this case, problems may occur in feeding the partner during sexual intercourse. In addition, sound from the vagina during sexual intercourse can reduce the concentration of people to intercourse. Some people may have poor healing of the stitches after vaginal delivery. In addition, there may be enlargement of the vagina due to some hormonal deficiencies. Vaginal tightening surgeries can be performed on patients with vaginal enlargement. Vaginal tightening is an operation that takes about 1 hour in a hospital environment, under general anesthesia, according to the needs of the patient. After the surgery, the person is usually discharged on the same day or after staying in the hospital for 1 night. If no additional operations are performed on the vulval area and labia outside the vagina, the suture marks of the surgery remain inside and the surgical scars are not seen from the outside. Since self-dissolving sutures are used, there is no need to remove stitches during the healing process. Frequently asked. After vaginal tightening surgery, the person is discharged on the same day or after staying in the hospital for 1 night. He can return to his daily life in a short time. This period varies from 1 to 2 days to 1 week depending on the person. In the first week, 1 to 2 weeks, a slight feeling of discomfort and edema may be seen. It takes 4-6 weeks for the vaginal area to fully heal. During this period, sexual intercourse should be avoided and swimming in the pool or sea should not be avoided due to the risk of infection. The person can take a bath with warm water 1 day after the surgery. Post-operative genital area cleaning and hygiene is very important. Since aesthetic stitches are used, the stitches will not need to be removed. It can be applied to women of all ages over the age of 18 who have complaints such as lack of sexual pleasure, loss of sensation, sound from the vagina, air leakage from the vagina, gas leakage from the vagina, recurrent discharge in himself or in his partner. Kegel exercises can be beneficial to some extent. These exercises are exercises that can be practiced at home, at work, even while driving. The goal here is to strengthen the pelvic floor muscle. These are exercises that should be performed then when the bladder is empty. These exercises can increase sexual pleasure, solve the problem of inability to orgasm, prevent urinary incontinence, prevent problems such as uterine prolapse and bladder prolapse. The most important feature of these surgeries is to obtain a permanent tightness. There will be no vaginal enlargement unless there is a normal delivery again. Vaginal enlargement is not just due to childbirth. Sometimes the vagina may enlarge due to the genetic structure of the vagina, and there may be an enlargement in the vagina due to frequent sexual intercourse and hormonal reasons. Vaginal tightening can also be applied to such women. This surgery is performed under general anesthesia. Mild pain and bleeding are expected after surgery. Dressing should be done as recommended by the doctor. It is important to use the medicines given by the doctor regularly and on time. Heavy exercise should not be done for the first month after the surgery. Do not enter the pool or the sea. Do not smoke, drink plenty of water, and eat regularly. Under these conditions, the success of the surgery is high and the recovery is fast. After such surgeries, sexual intercourse is not recommended for at least 4 weeks. Following your doctor's advice on this matter will speed up your healing process.